Here are 10 Puerto Rico Medical Board-style clinical vignettes focused on pulmonary diseases, asthma, COPD, pneumonia, ARF, with 4 answer choices and detailed explanations. Pulmonary diseases clinical vignettes. 1. Asthma pathophysiology and diagnosis. A 22-year-old woman presents with wheezing, shortness of breath, and nighttime cough that worsens with exercise. Pulmonary function tests show a decreased FEV1-FVC ratio that improves after bronchodilator administration. What is the most likely diagnosis? A. Chronic bronchitis, B. Emphysema, C. Asthma, D. Bronchiectasis. Answer: asthma. Explanation: asthma is a reversible obstructive lung disease characterized by airway inflammation and bronchial hyperresponsiveness. The decreased FEV1-FVC ratio improves with bronchodilators, distinguishing it from COPD. 2. COPD, chronic bronchitis versus emphysema. A 68-year-old male smoker presents with chronic cough producing sputum for over 3 months each year for the past 2 years. Pulmonary function tests reveal an obstructive pattern. What is the most likely pathologic finding? A. Alveolar wall destruction. B. Goblet cell hyperplasia and mucus hypersecretion. C. Pulmonary fibrosis. D. Granulomatous inflammation. Answer B. Goblet cell hyperplasia and mucus hypersecretion. Explanation: chronic bronchitis, a form of C, is defined by persistent productive cough due to goblet cell hyperplasia and increased mucus production. 3. COPD treatment and exacerbations. A 55-year-old smoker with COPD presents with increased dyspnea and purulent sputum production. He is tachypneic with wheezing and prolonged expiration. What is the best initial treatment? A. Corticosteroids alone. B. Bronchodilators and corticosteroids. C. Antibiotics alone. D. Oxygen therapy at 100% FiO2. Answer B. Bronchodilators and corticosteroids. Explanation: COPD exacerbations are treated with bronchodilators, beta-2 agonists, anticholinergics, systemic corticosteroids, and antibiotics if infection is suspected. 4. Pneumonia, community-acquired causes. A 72-year-old man presents with fever, productive cough, and right-sided pleuritic chest pain. Chest X-ray reveals a lobar consolidation. What is the most likely pathogen? A. Streptococcus pneumonia. B. Mycoplasma pneumonia. C. Legionella pneumophila. D. Pneumocystis jirovecii. Answer: A. Streptococcus pneumonia. Explanation: Streptococcus pneumonia is the most common cause of community-acquired pneumonia, CAP, presenting as lobar pneumonia with rust-colored sputum. Out of 5, atypical pneumonia. A 20-year-old college student presents with dry cough, sore throat, and low-grade fever. Chest X-ray shows diffuse interstitial infiltrates, but physical exam is unimpressive. What is the most likely pathogen? A. Streptococcus pneumonia. B. Mycoplasma pneumonia. C. Klebsiella pneumonia. D. Histoplasma capsulatum. Answer B. Mycoplasma pneumonia. Explanation: Mycoplasma pneumonia causes atypical pneumonia, commonly in young adults. It presents with mild symptoms, diffuse infiltrates, and a lack of significant sputum production. 6. Hospital-acquired pneumonia. A 65-year-old ventilated ICU patient develops fever, purulent sputum, and new infiltrates on chest X-ray. What is the most likely causative organism? A. Streptococcus pneumonia. B. Mycoplasma pneumonia. C. Pseudomonas aeruginosa. D. Respiratory syncytial virus. Answer C. Pseudomonas aeruginosa. Ventilator-associated pneumonia, VAP, is commonly caused by Pseudomonas aeruginosa, Staphylococcus aureus, and Enterobacteriaceae. 7. Acute respiratory distress syndrome, ARDS, diagnosis. A 50-year-old man with sepsis develops rapid-onset dyspnea and hypoxemia refractory to oxygen therapy. Chest X-ray shows bilateral diffuse alveolar opacities. What is the most likely underlying mechanism? A. Pulmonary embolism. B. Increased pulmonary capillary permeability. C. Left ventricular failure. D. Chronic bronchitis. Answer: increased pulmonary capillary permeability. Explanation is caused by alveolar damage leading to increased capillary permeability, pulmonary edema, and respiratory failure. 8. ARDS management. A 45-year-old patient with ARDS is intubated and mechanically ventilated. What is the best ventilator strategy to prevent further lung injury? A. High tidal volumes and high PEEP. B. Low tidal volumes and low PEEP. C. Low tidal volumes and high PEEP. D. High tidal volumes and no PEEP. Answer C. Low tidal volumes and high PEEP. Explanation: Aortic management includes low tidal volume ventilation, 6 milliliters per kilogram to prevent volute trauma, and high PEEP to prevent alveolar collapse. 9. Pulmonary hypertension and COPD. A 67-year-old man with long-standing COPD presents with exertional dyspnea, peripheral edema, and jugular venous distension. What is the most likely cause of his symptoms? A. Left ventricular failure. B. Pulmonary embolism. C. Pulmonal. D. Pneumothorax. Answer C. Cor pulmonal. Explanation. Chronic hypoxia from COPD can cause pulmonary hypertension and right heart failure, leading to peripheral edema and JVD. 10. Lung abscess. A 52-year-old alcoholic is brought to the ER after being found unconscious. He has foul-smelling sputum, fever, and weight loss. Chest X-ray reveals a cavitary lesion with an airflow level in the right lower lobe. What is the most likely diagnosis? A. Tuberculosis. B. Lung abscess. C. Pulmonary embolism. D. Lung cancer. Answer B. Lung abscess. Explanation. Lung abscesses are caused by aspiration of oropharyngeal contents, especially in alcoholics, and commonly involve anaerobic bacteria. Final thoughts. These vignettes cover